for 5 minutes.
Mr. Speaker, I rise today to share some of the stories of Alabamians who are being negatively affected by the implementation of the Affordable Care Act. Over the last several weeks, thousands of health insurance policyholders in Alabama have received notice that their plans have been canceled or altered and their costs have risen, some quite dramatically. This despite President Obama's often repeated and unmistakable promise to the contrary. He promised of the Affordable Care Act, quote, "If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period. No one will take it away, no matter what." Mr. Speaker, we now know this wasn't true. To make matters worse, the disastrous rollout of Obamacare website has made it nearly impossible for those affected to search for alternatives. The President didn't tell the truth, and the Americans who took him at his word are paying the price. I recently reached out to Alabamians asking those who have experienced health care plan cancellation or rate increases because of Obamacare to tell me their stories. The response has been overwhelming, and Mr. Speaker, I would like to share just a few of those stories here in the House this morning. Allison Strickland, a wife and a homeschooling mother of 4 from Dothan, writes, "We are a family of 6 with one income, and our premiums doubled from $420 to $940 a month. We are already under great financial strain, and this is not helping relieve any of the tension. At this point, we are unsure about what we are going to do. For growing children, we know insurance is vital, but at what cost to the daily needs of our family? We are very disappointed in the Obama administration." Sean Cunningham of Montgomery writes, "I am a married father of 2 beautiful little girls. My jaw dropped when I found out my family's premium was going from $400 a month to $722. I called Blue Cross first thing Monday morning, but I was told I needed to contact healthcare.gov for assistance. After 6 hours on the phone with them trying to apply for a subsidy, I did manage to find out that there was a cheaper premium. I could choose the Blue Saver Bronze at a rate of $545 per month, which was still an increase over the plan I liked. The other problem, my individual deductible would be $6,350 and my family deductible would be $12,700. I failed to see anything affordable about this." Chris Vukovich of Montgomery was notified that my policy was not ACA compliant. Paying $390 for family coverage, just found out comparable plan, Silver, would be $704. My out-of-pocket went up, so did deductibles and copays. We make too much money and will not qualify for, nor do I want, a subsidy. Lee Hayes Wyatt of Montgomery, our premium went up to $1,374 a month. Angela Zacchini of Greenville, our family of 4 is paying $417 a month, and it is going to $765 a month. Jim Harrell of Prattville, my doctor retired and told me that he was not going to deal with the changes in the Affordable Care Act, so I could not keep my doctor. Both of my adult daughters got letters indicating their policies were canceled due to not meeting all the requirements of the new law. New policies being issued will be about 33% more expensive. One has a specialist doctor who is now going to charge patients a costly fee up front each and then pay for services rendered. All of these effects are negative to my family. Mr. Speaker, these individuals and families are not statistics. They are real people from Alabama's 2nd Congressional District whose lives are being made more difficult because of Obamacare. I don't know why the President repeatedly misled the country about the true implications of this health care law. This is the kind of Washington doublespeak, political doublespeak people are so fed up with. And this time it is hurting people in a very real way. We have an opportunity here in the House this week to make it right by acting to protect Americans from these rate hikes and plan cancellations. And so that's why I'm a co-sponsor of Keep Your Health Plan Act. Keep Your Health Plan Act, which will allow health care plans currently being offered to continue next year, just like the President promised. This bill also ensures that Americans choosing to maintain their health care plans will not face a tax penalty under Obamacare. I appreciate the leadership of Chairman Fred Upton of Michigan in bringing forth this legislation. The Keep Your Health Plan Act won't fix every problem with Obamacare, but it will offer real changes and peace of mind to Americans affected by these changes. Mr. Speaker, this isn't a partisan issue. Republicans and Democrats alike recognize the basic unfairness that has occurred here. So I urge my colleagues on both sides of the aisle to support the Keep Your Health Plan Act. I yield back.
The gentlelady's time has expired. The chair recognizes the gentleman.